Welcome to the Ashi Acupuncture Podcast, sharing clinical tips and techniques to help you help more patients. Here's your host, Eric Shanky.
Hello, listeners. Today on this episode of the Ashi Acupuncture Podcast, I'm happy to present Jason Tutt. Jason Tutt is an acupuncturist in Vancouver, Canada. He specializes in treating pain. And Jason also blogs and podcasts at needlechat.com. Welcome to the show, Jason.
Thanks for having me, Eric.
Jason, you let me take a sneak peek at an upcoming blog post that you're going to do that explores the meaning of the word chi, and I thought you've got some great points in there, and so I want to start the interview and ask you, after all your research or in the midst of this research, what does chi mean to you?
Yeah, that's a huge topic and one that has become the epicenter of validating acupuncture and Chinese medicine in the 21st century. So what I can say first of all is that, in my opinion, chi is not energy. That's what I want to say first and foremost is I've looked at a lot of websites, I've looked at a lot of textbooks, and a lot of them define chi as energy. But if you look at some of the people who have translated some of the historical texts like Paul Unshold and other researchers who have great credentials, they all say that chi and energy bear no resemblance, and linking the two together bears no historical basis.
And I'm glad you brought that up. I mentioned this in a blog post that I did, that when you're in China, if you see a sign on the side of the road that says chi, it's where you can get air to pump up your bicycle tire.
And then
they don't fill their bicycle tires with energy. They fill it with
Yeah, and so the research that I've done has shown that the original word chi meant vapor, and then it got combined and evolved over time. They took the character for vapor and then they combined it with the character for rice, and they put them together. And a lot of people have tried to interpret what they meant by that, if it means everything from as light as air to as solid as rice, or maybe that, like it's talked about in Chinese medicine, you inhale the air chi and it combines with the food chi, and they combine to make the whatever you want to call it, pectoral chi in the chest, which then goes on to the heart. So there's a lot of debate whether or not they're talking about all existences of matter, and basically what I've come to decide is that when they're talking about chi, they're mainly talking about the body's functions in whatever regard they're using it. Very rarely do they ever say chi as a standalone. They always refer to chi. They're saying the chi of the liver, the chi of the spring, the chi of whatever.
It's usually combined with another character. That's what I've heard too, yes.
Yeah, and we hear yuan qi, zhong qi, zong qi, all these different types of qis, and they're all describing very different functions or substances in the body, which you could easily, in my opinion, translate into Western processes, like the wei qi. Wei qi is describing almost verbatim the immune system. They talk about wei qi flowing outside of the vessels, just like the white blood cells are not necessarily in the blood vessels. They go through the lymphatic system, so they're not in your typical vessels, and they protect the body from pathogenic invasions, just like the wei qi. So
don't you think that the word chi, it's almost become religious in our profession where if you attack that word, people, it's you're threatening their whole dogma.
Yeah, I've experienced that firsthand from a lot of acupuncturists when presenting the alternative sort of viewpoints on qi is they don't like having their qi taken away from them.
Don't touch my chi, bro.
Yeah.
Um, it gives. I think it's fascinating though if the ancient Chinese described these complex processes, and maybe they couldn't describe it in a very specific biochemical way, but even the awareness of the existence of those processes is an incredible achievement and contribution to medicine. And if we can start to lose our dogma a little bit and understand that they're talking about the same body that modern science talks about. The ancient Chinese were talking about the same body. They just use different terminology. I just think that to me that's exciting. It's exciting that if we can, that'll bring the real synthesis of the two medicines.
Yeah, if I could just touch on that. Um, in part of my research for understanding the original definition of qi, they also used it as part of wind, and the ancient Chinese had recognized that there's something that exists in the wind that attacks the body and brings disease. And it sounds a lot like how we have viruses and, airborne viruses and bacteria that can kind of travel through the air and attack the body. And so I think that's kind of where it started, and then it evolved over time to where we see it today.
Again, just another facet of their amazing achievement. I mean, how did they know there were viruses? It's really amazing, amazing that they were able to perceive that stuff. What's your practice like now, Jason? Do you manipulate chi when you're needling patients?
No, I don't. If I can talk a little bit about why the term qi bothers me so much is throughout school, I had probably 8 different teachers, and they all had different definitions of qi. My first teacher was Caucasian, and he taught us foundations, and his definition of qi was very simple. It was function, nothing more, nothing less. We
Mm,
had another teacher who was trained as both a medical doctor and a doctor of traditional Chinese medicine, and he tried to bridge the two worlds of Eastern and Western medicine together. So he would also always give us the Western equivalent to, for example, um, Ying Qi, he said, was like the plasma in the blood, bringing nutrients to the organs. And then we had another teacher who just said, oh, it's like energy. And then we had another teacher who said, no, it's not energy. And I said, okay, well, what is it? And he says, I don't know. I've been searching my whole life for this question, and nobody knows what chi is. So this really frustrated me that I couldn't get an answer, and all the teachers had slightly different answers of what chi was.
You got the
And
you got the whole spectrum. When I was in school, I just think it was kind of accepted that it was energy. So I'm I'm glad you got a fuller spectrum of belief.
oh yeah, exactly. And when we started um, treating based on meridian, I noticed that I wasn't seeing anything necessarily miraculous in the school clinic, even from our teachers who had 15, 20 years experience. I didn't see people getting over anything that couldn't necessarily be attributed to just the natural healing course. But what
Right.
I did see time and time again was if someone was coming in for shoulder pain or back pain, our results were pretty regularly predictable, 2, 3, 4 treatments. Obviously, our ability to treat those were not as good as when you're still learning as they are now, but we were able to regularly get results from muscle pain, strains, sports injuries.
And
And
at
so I
that,
just said, I'm not,
I'm sorry, at that time, were you
go
doing
ahead.
all You were doing Assure points for that, or was it you were doing meridian points to help, say, shoulder pain?
We were doing a combination of the Ashi points as well as some experience points. So bladder 40 Wei Zhong is one of those experience points or empirical points used for low back pain. So we would always use that. But yeah, so we'd use a prescription of points used for different types of pain, but also Ashi points were a big part of it as well.
And so, how did your practice evolve? Do you still use the meridian points like bladder 40 for back pain, or what? How's your practice different now?
Well, over a period of time, I started getting into sports acupuncture and learning how different muscles are involved in pulling certain muscles out of alignment. So, for example, muscles in the glutes or even in the hamstrings can certainly pull on the back and throw the back out. So the way that I look at it now is I look at where the pain is and what surrounding muscles are possibly contributing to that. So I don't use specific predefined acupuncture points anymore. I look at where is it tender, where is it tight, and then I needle those points to try to get the releases that I'm looking for.
Yeah, I think that's really similar to the way I practice now too, where yeah, I may treat bladder 37 for back pain, but I'm doing it to release the hamstring so that quits tilting the pelvis. I'm not doing it because of the chi of the bladder meridian or anything like that.
Yeah, exactly.
Yeah. Um, for listeners of my show, I one of my pet peeves is mentorship. I'm a real big believer in apprenticeship and mentorship. Uh, Don't you have a mentor, or haven't you had a mentor? Could you talk about how you met your mentor and how your apprenticeship started?
Yeah, so I have a mentor named Dr. Rod LeBlanc, and he is just an amazing teacher. He's a wealth of knowledge, and all his patients, I've done some job shadowing with him, and all his patients always says he's a master, even though he's way too humble to ever refer to himself as a master. But he he does the same sort of Asher style acupuncture, but it's more based on trigger points. And he's able to know exactly where the problem is just by asking you, okay, where's the pain? And he knows which muscles are involved. And I found out about him because I was trying to look for somebody I could learn sports acupuncture or Asher acupuncture or trigger point acupuncture, looking for somebody who could teach me those things. And I just kind of luckily found him on Google. And he's a big pain specialist in Canada, and he happened to be about 30 minutes from where I was. And I found that he was teaching a course on trigger point injection therapies. And I said, "Oh, this is perfect. This is right up my alley. I'll take this course and see what I can learn from this." And I was just blown away by taking that course with him. And after taking that course, I've kept in regular contact with him and done some job shadows. And every time I work with him, I learn something new. And I think that having a mentor, somebody to kind of, because when I first got into sports acupuncture, I was really worried about needling the neck because there's so many vital structures in there, like the carotid artery, the jugular vein, right, the
Mhm.
vertebral artery. There's
And do you mean the front of the neck, the anterior neck? Is that like the scalenes and the SCM?
Yeah, the SCM, I was terrified because it's right over top of the carotid artery, and I was just terrified that I was going to kill somebody. And
I mean,
so I said,
it's good to be cautious there, but yeah.
yeah, so I contacted him and I said, look, I'm just not comfortable needling the neck. And he said, yeah, come down for a few days and let's do a job shadow. And he showed me probably a lot of people to him for neck pain, so it was perfect. And he showed me exactly how to, grasp that muscle, pull it away from the midline, and
Mm.
needle away from the direction of the carotid artery. And once I saw it a few times and did it a few times, I was comfortable with it. And I just didn't get that type of close instruction in school.
Yeah, and mentorship is just so important. I'm glad you spoke about your personal experience, because I'm a big believer in having a mentor, and because you can really learn the practical aspects of needling. It's so important. And it sounds like you mentioned trigger point work, and this is one thing I've talked about before too. I hardly ever read any books on acupuncture anymore. I'm not interested in those metaphysical theories anymore. They just don't seem to have a lot of clinical relevance to me. But trigger point books, those have a lot of good useful clinical information. And I guess I could understand how you fell in love with trigger point injection work when you saw it. It's real practical. It's anatomically based. It's easy to understand.
Yeah, and just the sheer difference in how fast people respond to trigger, at least in my experience. I know I've spoken to several acupuncturists who violently disagree with me, but that's okay. When I see trigger point work being done, I'm seeing differences in 2-3 treatments that, like, I'm talking huge differences. Whereas I've done a job shadow with a guy who was using the Master Dong style acupuncture, who had been treating this particular lady who had shoulder pain for probably 2 or 3 months, twice a week. And, she's like, yeah, there's some improvement. It's a work in progress. And I shook my head. I was like, wow, I wonder how much this lady has spent. And she's had some improvement, but when you talk to some of my teachers, like Dr. Rod LeBlanc and my other mentor, Cynthia Gokavi, who's a big trigger point dry needler as well, they see huge differences in 2-3 treatments for the exact same condition.
I agree 100%. I would go so far to say, as if you haven't gotten some really significant improvement in 2 or 3 treatments, you need to refer out.
Yeah, that's actually, we have a law in BC, Canada, which is the province I live in. If you haven't seen an improvement in the patient's condition after 2 months, you're told to refer out. And I think that's pretty important, because there's only so much that a patient should have to go through. This particular lady, her entire right side was just covered in bruises from bloodletting and cupping, and yet after all these treatments, she still was, maybe 10-20% improvement. So I think that it's important to realize that when you're not seeing those types of improvements, you should refer out to somebody who's maybe a little more capable than you are.
And just my last plug for mentorship. If you don't have a mentor, then how do you know how many treatments it's supposed to take? How do you know when, if you're making typical progress or not? Because you're just flying blind. You don't know. Should I see improvement in 2 treatments or 10 treatments? You don't know. But with a mentor, if you shadow him, you know the standard you're supposed to be getting. And if you're not getting that standard, then you need to either improve your skill or it's something that you need to refer out for.
Thank you for listening. Watch for Eric's book on advanced Ashi acupuncture techniques. Don't miss being notified of its release date and when the latest blogs on useful clinical tips and techniques are posted. Stay informed and up to date by signing up now at our website, ashi-acupuncture.com. Now back to the program.
Jason, you recently learned prolotherapy, didn't you? Could you talk a little bit about prolotherapy, the basic concepts of prolotherapy?
Sure, I'll do my best. I literally just learned it a week ago, but it's quite fascinating actually. And so in trigger point therapy, you're dealing with the trigger points, the little tight focal points in the muscle bands. And in prolotherapy, what you're dealing with is where the tendon actually attaches to the bone. And if that becomes weak or stretched or damaged, not to the point where it's torn. If it's torn, you do have to send that for surgery. But in those other cases, what you're able to do with prolotherapy is use a cocktail of a few substances, including either dextrose or glycerin, and then a local anesthetic like procaine or lidocaine. We prefer procaine because it's less toxic than lidocaine, and some vitamin B12 to enhance the cellular metabolism. And you mix those three together, and you're basically doing a combination of bone pecking and injecting that substance into the tendinous attachments, and then it creates like a local acute inflammatory response and
And
strengthens. Go
I'm
ahead.
sorry, is the dextrose, aren't some of them I think they term it a sclerosing agent where it'll actually cause some scar tissue to build up? Am I misunderstanding that, or is that true?
Um, I'm not entirely sure about that.
Okay, maybe it's
I
something we
think
could
I
do.
may have heard that before, but yeah, no problem.
So when would you consider just doing straight acupuncture, or when would you consider doing prolotherapy? Do you have an opinion about that, or can you share any thoughts about that?
Yeah, so as I was mentioning with prolotherapy, um, you're dealing with the tendinous attachments, whether they're damaged or stretched or weakened. And what the prolo is going to do is it's going to strengthen um, the ability to hold the muscle where it needs to be. And if that's not possible, then the muscle becomes, flaccid, and it loses that proper gliding motion. So that's really mainly for the tendinous attachments. You wouldn't do that on muscles themselves. So if you're doing trigger point releases or trigger point injections or acupuncture of the muscle, and you keep treating the same muscles over and over again, and they're just having the same injuries or problems. Now, they're good for a couple of weeks. They come back, oh yeah, my back's out again. Oh yeah, you should maybe consider that there's something going on with those tendinous attachments, and that would make you a good candidate for prolotherapy.
Oh, okay, that helped me understand it better. Could you also use it on ligaments? Say someone had a old ankle sprain and their ligaments were kind of lax. Could you use prolotherapy at that time too?
Yeah, that's actually the best time to use prolotherapy.
Is for ligamentous stuff more? Is that what you mean?
Yeah, like if you've sprained a ligament, for example, in your ankle and it's lax like that, then you can absolutely use prolotherapy to strengthen and tighten those ligaments and bring them back to where they were before the injury occurred.
It sounds like a worthwhile therapy to learn. Now, is prolotherapy a recent addition to the scope of practice for acupuncturists in Canada?
It is, yeah. Some acupuncturists have actually been practicing it here with the knowledge of the regulatory college for around 15 years.
Wow.
And but it's sort of considered a high risk therapy outside of our regular scope. It's considered part of the expanded scope. So right now we have a society that's set up for this expanded scope, and basically the regulatory college is okay with us doing it as long as we have a certain amount of training approved by this society. And so it's not part of the official scope of practice yet, but it has been presented to the college, and they're going to make, and the Ministry of Health as well, and they're going to make a final decision whether to
And
include it in our official scope of practice.
is that society, is that a countrywide society, or is it just in the Vancouver area? Is that a silly question?
No, it's in our province, BC, and so every province is slightly different in Canada, just like in the United States,
Mhm.
where like in BC, only acupuncturists and physiotherapists and obviously medical doctors and well, actually, and naturopathic doctors as well can do acupuncture. Whereas in another province, actually the province where the capital of Canada is in Ontario, that also includes massage therapists and chiropractors. So pretty much anybody who can touch somebody can use needles over there. So yeah, the society is set up for BC only, but we're hoping to kind of set the pace for the other provinces to follow suit.
So in some way, I don't know that any state in the U.S. allows acupuncturists to perform prolotherapy, but I do know some states allow acupuncturists to do injections, say of vitamins or herbs, things like that. That's something in your scope of practice too, isn't it? Injection of amino acids and vitamins.
Yeah, injection of amino acids, vitamins, and minerals as well, depending on what they are. And um, we use that. It's part of the expanded scope of practice, just like the prolotherapy and the trigger point injections at this time.
So that's a BC only. That's a BC only scope of practice. Is that right?
As far as I'm aware, yes.
Uh-huh. And when you inject the amino acids or vitamins, is that to have a systemic effect in the body, or is there a reason to do it in a specific locale? Are you trying to have a localized effect or a systemic effect?
Generally, it's systemic. Where except in the case of the B12, when we often use B12 with the trigger point injections and the prolotherapy to help increase the cellular metabolism in that general area that's being worked on. But in the other vitamins and minerals and amino acids, we're looking at a systemic effect or possibly correcting a deficiency or a inadequacy. Because a lot more people, especially B vitamins, a lot of people have suboptimal levels, even if they're supplementing. Taking more than the recommended daily allowance, just not enough is being absorbed. Too much of it's just going right through. So it's a good way to get a larger amount in the body without having to worry about it being destroyed by the liver.
Thanks for sharing that, Jason. Jason, you've got a website, needlechat.com, and I think you're putting out great information. How did you get started? How did you get started doing that? What was your motivation?
So needlechat.com is a project that I've been working on for, I don't know, a couple months now. And basically it started with my frustration that the majority of acupuncturists that I've been talking to have no interest in research, acupuncture research. And whenever a study comes out that makes the headlines in the news, it says acupuncture does not outperform placebo, the majority of acupuncturists say, oh, Western medicine can't understand acupuncture, therefore their studies are invalid. And I really don't agree with that. And so I've been trying to put together a string of blog posts and podcast interviews, like the interview that I did with yourself. And I've got several great guests coming up on my podcast that are really going to surprise some of the acupuncture community. And just to talk about things like research and the original origins of acupuncture, and to get people excited about looking at acupuncture from a Western scientific point of view, understanding that being literate in the research is not so scary. Anyone can do it. And there's a lot that we can learn from the research, but we just need more acupuncturists who are willing to contribute and get excited and start talking about the research, and then we can look towards developing better research protocols and discussing what changes need to be made and things like that.
Yeah, personally, just recently, I'm starting to get sick of the common criticism that acupuncturists have of Western science is, oh, well, it's not holistic, and so therefore it can't evaluate what we're doing, and that's not really a valid argument. It's the equivalent of saying, well, it's stupid. Western science is stupid. It can't understand this whole big picture. But I think there's several good examples that science can understand the whole big picture. You know, we can study geography and know the minutia of some little area on the planet, but we can also see the big planet. I don't think science is damned to never being able to study a holistic system. And I think if we're going to criticize something, we need to offer some real legitimate arguments and not just, oh, it's just stupid. Yeah, you have any comment on that?
Yeah, I agree 100%. Anytime you see a study come out that shows acupuncture in a good light, like functional MRI studies, which show that it's activating and deactivating certain parts of the brain, or whether it's, a study showing that certain acupuncture points will increase blood flow in certain organs compared to other points. Anything like that, the acupuncturist will be like, see, we told you acupuncture works and these studies prove it. And then when a study comes out that shows that acupuncture maybe doesn't do what you claim that it does, they go, oh, that's garbage Western science. So there's a funny double standard going on.
Exactly. And I mean, they call this confirmation bias, right? That we're
Yeah.
all prone to. We tend to see evidence that supports our own bias. We tend to see that as more important or more relevant than evidence that contradicts what we think. So, yeah, and this is the whole beauty of the scientific method. We can debate about certain little aspects or of one research study or another, but in the bigger picture, the scientific method is really a way to try to eliminate bias as much as humanly possible. And I think it's important to realize how valuable the scientific method has been to just raise humanity up from where we were a couple hundred, even only just a couple hundred years ago.
Yeah, I agree 100%. There's a lot of questionable recommendations that I've seen that go right against everything we know in the scientific method, and I often, just shake my head when I see some of the things that we're advocating these days, especially from the acupuncture community. So I think we can learn a lot.
Yeah, there's just a big streak in our profession where it's really I don't know what term to use. I'm going to say new ageism, where all that matters is your intention. As long as you have a good intention, you're going to get good outcomes and things like that. And it's just ridiculous and unscientific and irrational. And I think those people, honestly, they're a detriment to our profession, and our profession needs to have higher standards and move forward to be accepted into the modern scientific world. Jason, how can people connect to you and stay informed of your latest blog posts and podcasts?
Yeah, so the best way is just to go on needlechat.com, and I'm always making new blog posts, and every 1 or 2 weeks I'm putting up a new podcast interview. Or if you want to contact me on Facebook, Jason Tutt, JASONTUTT. You can contact me on Facebook as well. I'm always on there. There's a lot of acupuncture Facebook groups that I'm a part of. So if you really want to get in contact with me, you can use any of those.
All right. Thanks so much, Jason. I'm a big admirer of your work, and I follow all your blog posts and podcasts. I really appreciate all the hard work that goes into what you're doing, and I hope you'll keep doing it. It's a big help to the profession. Thanks for taking the time for the interview today, Jason.
Thanks for having me on.
We hope you've enjoyed this episode of the Ashi Acupuncture Podcast. We'd like to hear from you. If you have a question, topic idea, guest idea, or a particular technique you'd like to hear discussed on the show, contact us at our website, ashi-acupuncture.com. That's ashi-acupuncture.com.